walk. As Linnea mentioned, before I went into formal public health, I was actually in pediatric practice for about 15 years, and I was a very strong promoter of breastfeeding and the WIC program, and well, it's been wonderful to see the evolution of the WIC program into a major proponent of breastfeeding. You know, it wasn't that way 20 or 30 years ago, and it's been a huge change, and that obviously has become a major focus. So I salute the association, I salute our program folks, and I salute all of you who are involved in one way or another in promoting breastfeeding. Obviously, the theme, you know, the right choice in hard times is certainly appropriate. Breastfeeding is certainly the most economical way to feed a baby. From a pediatrician standpoint in public health, it's the one that best promotes health outcomes, both for the child, acute outcomes, less gastrointestinal disease and respiratory disease, but in terms of chronic things, asthma, obesity, etc., it's the best step forward. From mothers, you know, decreasing the risk of breast cancer and ovarian cancer, and helping manage weight, and particularly decreasing the likelihood of type 2 diabetes. Those are science-based health outcomes advantages of breastfeeding. Obviously, as a result of that, less healthcare costs, but really the most important reason to support breastfeeding is it's just the right thing to do. It's the best food for kids, and that's the main reason. And of course, a strong secondary reason, it is the best way to affirm, to solidify that bond between mother and child and baby. So we're strong supporters. We're very proud here in California that the vast majority of mothers in this state leave the hospital having had their baby, having initiated breastfeeding. We're very proud of that. We want to continue to work toward a goal to ensure that that's the standard for every child born here in California. Linnea mentioned a number of major accomplishments and things that will help forward this food package deal with the WIC program. We see it as being transformative in communities, and I'm also glad to see it talked about in the context of breastfeeding support, providing a much larger range of healthy options for mothers who are choosing to breastfeed and for the babies, certainly following their first 6 months of exclusive breastfeeding, you know, introducing even a healthier range of things for them to do. Some other things that you may not be aware of, that several years ago, following the governor's attention to obesity, we developed an obesity prevention plan, and recently we've been successful in acquiring a 5-year Centers for Disease Control grant that is allowing us to get much more specific about specific actions that need to be taken to implement that plan. And we were very thrilled when breastfeeding was recognized as one of the top 6 strategies in overall addressing obesity. So we are very busy about the work with the CDC funding support in developing specific activities that will assist us in promoting breastfeeding as an obesity prevention thing. The other thing that was very exciting to learn more about just recently was the several $million that have been designated through the WEC program to support the peer counseling program, the mother-to-mother peer counseling program. I understand that that's spreading throughout the state, and we're expecting additional resources to bring that up to scale throughout the state. But obviously, this is a great support for mothers intending to breastfeed, to have mother-to-mother peer counseling. We think that's a great idea, and we'll continue to support that. Our maternal, child, and adolescent program has been very busy working specifically in the hospital settings to ensure that all hospitals where babies are delivered are more baby and mom friendly, and particularly have the capacity and the knowledge and the expertise to be able to support breastfeeding within that context. So there's a lot of stuff going on. And of course, right within the new Department of Public Health, we've made a major commitment to ensure that lactation rooms are available throughout our own facilities throughout the department, throughout the states. We feel like we've stepped up and done what we should be doing as good employers. And of course, one of the main things we're here today, following the 2001 legislation addressing lactation accommodation in the workplace, we're very happy to be able to salute a number of employers who have stepped up and really made their organizations breastfeeding and mom-friendly, and we're happy to be able to celebrate that today. So once again, thank you all for coming out. Thank you for participating in this event.